especially in India, could find meaningful opportunities and in turn help to provide better and easy access to affordable veterinary healthcare. Then we have Dr. Dinesh, who is part of FIAPO, who heads the animal health and welfare for us. He is a postgraduate veterinarian major in surgery, comes with over 18 years of experience in the animal welfare sector. So he has a lot of experience dealing with equines and has a lot of insights to share with all of us. So please take a lot of notes. This is going to be insightful as well. And if there are any queries, please feel free to drop them in the comment section. So if there's anything that you like to ask, anything that you have doubts on, we will get to them at the end of the session. So we will begin with Dr. Dinesh, who will start off, and then we will gradually move to Ilona. So thank you everyone once again. Looking forward to your participation. Let's begin. Thank you, Doctor. We can begin.
Thank you. Thank you, Akash. Thank you for a nice introduction and allow me to speak before, all the interesting people. They wanted to learn about equine health particularly. So today I'm going to talk about the basics of equine and how they differ from other animals, particularly cattle, ruminant cattle and dogs and cats. So I'm going to cover these three topics: how the equine is unique species and how they differ from other animals. And we will also talk about the basic of equine behavior and their human handling. And we'll talk about most common health elements, not in details, but the list of the most common elements, and maybe one or two we can talk. And whatever the pictures I have used and the information, that is only for education purpose, and those belongs to the copyright institutes or organizations or individuals. So uniqueness about the equine species. Equines are, meant to run. That means, the most mammals have multiple toes. Like, cattle, they have 2 hoofs. Dogs, they have 4 paws, the toes. So in the same way, in equids, over the period of evolution, they have only 1 toe. What does that mean and how it is relevant to in our routine practice? That means they have a solid 1 toe covered with the hoof, and because of that, they can run fast, they can cover long distances, and that is the uniqueness about the equid species as compared to others. Also, the equids, I hope everyone understand equids means it has 3. Equid is a species which has horses, mules, and donkeys. So whenever I use equids, means about all of these 3 animals. So in equids, the the structure of limbs are very unique. They have strong ligaments and tendons and very less muscles at the feet, in the limbs. All limbs covered with the proper ligaments and tendons. So that gives proper strength to run. That is uniqueness about the equines. As compared to other animals, they have the muscles and they are multiple toes, so they cannot run or they cannot mean to run. So that is the uniqueness of equids. As far as donkeys, the hoof shape is little oval and upright. Because of that, they can use in the mountain or very rocky areas they can walk. But horses can run at the ground field very fast, and that's the uniqueness about this. Also, if you look into the anatomical structure of horses, their lung capacity is more. They are obligatory, breathing through nose. So many, all these anatomical structures, they are meant to walk. Yeah. Am I audible?
Sorry, if you can just click on the slide, doctor.
Okay,
Can
okay.
you click on the third or fourth
Is it
slide?
is it moving?
It is not moving.
Okay. It's moving now?
It is moving now, yes.
Oh, sorry. I'm extremely sorry. I didn't know. I thought it is
No
visible.
problem. Yeah.
Okay. So that the uniqueness about the horses. I mean, their feet is important. That is one of that uniqueness of this species. As I have told you, the donkeys have a little different. I mean, although they are, but they are the solid and they are very tough to walk on the mountains and rocky areas. Same way, the another important feature of equines, this species is their digestive system is very unique. They have the long intestine. Their digestive system is very long. Particularly the intestine is very, very long. Although they are the monogastric, in the simple stomach animal, but they can, digest very low nutrient and convert into the energy. So they can, so that's why they call as a hindgut fermenters. So, but in cattle, those they have 4 stomach. In dogs and cats, those are the monogastrics. And horses are herbivores. they graze plants and shrubs. Whereas dogs are omnivores, cats are obligatory carnivore. So the horses, they graze more around 18 hours. Why? Because the acid in the stomach, release continuously. So they need continue feed. If they don't feed, they develop the gastric ulcer, the ulcers. Okay, so because of that, they need to feed continuously. Another important feature is horses' teeth are continuously growing. Their the roots are very small, but the crown, the outside which is visible, those are long. If you see into the picture, the horses' teeth are long and they continuously grow throughout their life. So to control this, the nature has given a unique feature that these teeth should wear continuously. So how they wear? Because of continuous chewing the feet. So because of that, the teeth are, there is a wearing of teeth. But sometimes the wearing is not proper and they leads to some dental problems. Maybe Ilona will talk on that topic. But that is a uniqueness about the horses and this equine species. The teeth, their digestive system. So these are the uniqueness. The next one important feature of equid is their ears are very, ears and eyes are very sensitive. They respond to the sound. They also alert from the predators. So nature has given that uniqueness. If you see the horse eyes, those are located on the side way. The side, on the side of the face, not in the middle, because horses are the prey animals. They are not predators. As compared to predators, their location is in the middle of the face. So in horses or in the equines, the donkeys, horses and mules, the eyes are located on the sides. Because of that, it gives an opportunity to see the wider picture. So they can see the predator, which and get the alarm of danger, and they run. So their location. Another uniqueness of the eye is their pupil is horizontal. It's not vertical like in cats, and like in dogs it is the round one or oval. But in the horses it is horizontal, so that they can view a wider area. In horizontal axis they can see. They can see the predators. They can see the danger and react accordingly. So why I'm telling this uniqueness? Because all these are related with their behavior and subsequently with the handling and the study. So each anatomical structure is very, very important to understand the species behavior. So horses' ears, horses' eyes, horses' feet, everything is important to understand the species. When, unlike other animals, horses or the equine can see around 360 degree, means they can see around surrounding all everything are surrounding them. So they can see very little. I mean, we technically we say binocular vision, means with the both eyes they can see a thing in front of them, but that is very around maybe 40 to 45 degree. But rest of the area they can see with the one eye. Monocular means they can see independently with one eye. So this is because horses are prey animals. So for any danger they can fly. I mean, they can run away. So because of that, that uniqueness is important for their survival. Also, the equid species is social. They live in the herds. They are not. They don't live in the pack like in dogs, but they live in the herds, and they groom. They social. They are social animals. Donkeys also, like in case of wild donkeys, those are solitary. They are independent. But since domestication, now donkeys also a herd animal. They are a very social animal. So this is all uniqueness of the equine species. And these are some differences. I have summarized it, not details, but I'm trying to give the uniqueness of the equine, how they are differ. Like I mentioned before, horses are herbivore, means they live, they eat plants and plants. Their feet is also, they have one toe, which is covered by a hoof. Their digestion is hindgut fermenter, and they are the herd. They are the herd animal. Okay, and they are the prey animals. Like same in the cattle. Cattle is herbivorous, but they have the 4 stomachs and they have 2 toes. Because of 2 toes, they cannot run properly. They can walk, they can run, but with limited. I mean, we cannot compare the cattle with the horses in terms of running or endurance. And cattle is also herd and prey. And the cattle has, that's why they have the defense organ, different defense organs, like the horns are the defense organ for them. Like in dogs are omnivore, but most of them are on the non-vegetarian, but they can eat vegetarian also. And they have, since they have 4 claws and all. And cats are obligatory carnivore. I mean, they are the non-vegetarian carnivore. So this is just, I have summarized. If you want, you can note it down, or everything is available nowadays. But just wanted to give the glimpse of the difference. So whatever we mentioned before, it's all related with the equine behavior. We need to understand equine behavior before approaching them, or understand the problem, pain and suffering in these species. As I mentioned, these species in any danger, they prefer to flight. They don't fight. In very rare cases, they fight. I mean, they can bite, they can, kick, or they can even crush with the body. But they prefer to flight, or they run away. That is their basic instinct. Similarly, they are the grazers. They graze continuously. More than, around 18 hours, they always need feed to, chew. And they are the good learner as well. They are smart, sensitive, and they remember. And their communication is also very important. And these are the anatomical, the ears, tails, and eye, and their posture or their stance is also indication of their behavior. So once we understand the behavior, the next part is handling and restraining the equine. Although theoretically it is very difficult to understand, we need a practical, for the proper handling and restraining, we need a practical, we need a practice actually. So whenever you want to approach a horse or donkey, see, the horse and donkey, they have different behaviors. So, but in general, whenever we want to approach, always approach with the size. Never see into their eyes. Always look into either their shoulder or feet, and then only approach. Before going to going near to the animal, talk, use kind words, talk calm, voice. Any sudden moment, any voice that leads to these animals react negatively. So always handle with caution, and always understand their danger zones. What danger zone means? The area where animal can react. They may bite, or they may kick, or they may crush you. So those are like, the head this area where they can bite, then the legs, back legs, they can kick, and the whole body. So these are the areas. So you need to understand which are the danger zones and how to approach the animal. We generally, in practically 35 to 40 degree angle, we go to one side and approach the horse. And once we reach near to the animal, always prepare before prepare the be ready with the tools, particularly the harness or the leash, and the head collar is very, very important. Without head collar and leash, you cannot handle equine. That is a uniqueness. So you have to, once you reach, you have to apply the halter or lead rope, just put on the neck, and then touch to their nose, let them smell, and then apply the head collar slowly, and then tight it. And once you tight, make sure it should not be too tight. So I mean, the horses, one of the characteristic is they don't like the pressure. They always want release, but that doesn't mean we can't give them the training. I mean, so what is the uniqueness is, if you want to lead a horse, first you will pressurize them, or you will pull them, then just release it. So that is the technique. It is very difficult to tell you over the theoretically, but pressure they don't like. So always we need to pressure and release. That's the technique. And after this, you have to reward them. So this is very, very important for handling. Otherwise, if you, and another important is, always be confident. If you scared, they understand your vibration, and then you may be in danger. So they may kick or they may bite. So be confident while handling. And the last one topic is the most common health ailments. So in this species, one of the most, we call it as a number one killer of equid is colic. Colic is nothing, is just stomach pain or abdominal pain. Pain may rise from anywhere in the body, but colic is the most gastrointestinal origin. So colic is always an emergency. So what happens? There are many reasons for this health condition. Like if the food is not good quality, or dirty food, or animal is dehydrated, or if the teeth are not proper, they may not chew properly, and half chewed particle may go into the digestive system and stuck. Or sometimes sand may go along with the feed. Another reason could be worms or parasites. They may also lead to colic. So there are a number of reasons: dirty water, less water intake, or dehydration. So all these leads to colic, and colic needs to be addressed immediately. Otherwise, animal may succumb. So this is one of the important. Whenever we talk about horse or donkey or mule, colic is considered as #1 and important health elements in this species. Similarly, foot problem is very, very common in this species because as I mentioned, foot is, I mean, there is a saying, no foot, no horse. So foot is very, very important. Taking care of foot, I think Ilona will tell you about this. Their balancing, their affections, everything. So foot problem is very common. Then third one is injuries or wounds. Because of the high movement of the legs, these species develop proud flesh. Proud flesh means they may not heal and they grow, the granular tissue grow more than epithelial tissues. So wound management is very important. Any small injury, any invisible injury is very dangerous. That leads to develop the disease, particularly tetanus. Tetanus is #1, I mean, another important disease. But tetanus is 100% preventable disease. So vaccination is the only way. And once tetanus develops, it is very difficult to reverse that. So tetanus, because of tetanus is also dreadful disease. Then foot problems, colic, and wound and injuries. These are most common health elements in this species. Another important problem is heat stress, in particularly tropical season. I mean, in our context, Indian context, and that too in the summer season. So, horses, they sweat a lot. I mean, that is one more uniqueness about this species. They sweat a lot. I mean, their body thermoregulation or their evaporation, the thermoregulation happen with the sweating. Like in dogs, they pant more. Panting is, through panting, heat is disseminated. But in horses, sweating is the primary thermoregulation way. So because of sweating, they lose water from the body, and it leads to heat stress, and in some cases may heat stroke and shock and death. So heat stress is also very, very important in in Indian context. Then these are the health elements like strangles, that is the infectious disease. Then influenza is also one of the infectious disease. And then some protozoal disease, particularly babesiosis, then trypanosomosis. In horses, this disease we call as a SARA. And parasitism, that is a worm load. There are different types of worms, strongyloids, ascarids. So this all leads to health issues. But these are the most common. There are many. But I wanted to mention here only the most important. And to cover this disease, I think this webinar, this 1 hour or half an hour is not enough. So the idea was just to tell about the uniqueness about these species. And if once you understand their uniqueness or importance of these features, you can understand their behavior, you can handle and restrain them properly. And that's it. Yeah, these are the, just pictures of colic. These are the signs of colic. When animal in pain, so they may roll, they may look towards their bellies, they paw, or they frequently sit and stand like that. So these are the colic signs. That means animal is in pain. The heat stress, and for heat stress, animal, the sign is the nostrils get flare up. Animal's body movement is from forward and backward, and the animals are depressed. How we identify animal is depressed means their head always above the top line of their body. But whenever the animal is in depressed, the head is downside of the top line. So in heat stress, the treatment is very, very simple treatment. We need to bring the animal in shade, provide the cooler environment, offer water, bath them, or hose pipe, use the hose pipe to bath them. So these are with these simple steps, we can save the animal's life. So these are some references. One is there is a Equine Veterinary Manual, working Equine Veterinary Manual. Then Donkey Sanctuary is another, you can use it for further information. And you can visit FIAPO's website where we are working on donkey project in Maharashtra. So for more or for any doubt, you can connect to FIAPO or me. Thank you very much for listening. Any question or suggestions, please? Akash.
Thank you. Thank you very much, Doctor. Over to you, Ilona.
Okay, thank you. So yeah, thank you, Dr. Dinesh, for all this. This was very, very good. I will sharing the same kind of view. So you will see the slides. Are you seeing my screen now?
Yes, yes, it is visible.
It's good. Yeah.
Okay, fine, right. Okay, so I'll get on to this. Some of the, Dr. Dinesh covered nicely a lot of the basic important thing of understanding about the horses. I will often, when I teach about horse-related matters, especially to veterinarians in India, I tend to talk about or make the division between organized sector and an unorganized sector. And with organized sector, I mean horses that are in race courses or at racehorse stud farms, well-established equestrian sports stables, riding schools, and other breeding farms. And then with unorganized sector, I talk about working horses or working equines, and then more like hobby farms and stables, as well as shelters. Just checking at this point, so you are seeing my slides getting changed, I hope. Yes, I hope. Am I audible? And you can,
yes,
you
yes.
can see my, and my slides are
Yes, audible.
yeah, fine. Okay, fine. Yeah. So, so I'm focusing, and in all our work, we are focused on the unorganized sector. I use this term more than a working equine because some of the horses in the unorganized sector are not technically working, but there are certain similarities, and when it comes to the health issues, I find this distinction makes sense. So some of the main concerns that the unorganized sector has are so we have the tourist riding or actual so working horses that are used for transporting different goods. And we have ponies, we have the thoroughbred ex-race horses, we have Indian indigenous breeds, Marwari Kathiawadi breeds, and then ponies. The issue with these horses often is that when they are not in use, they are left to roam on the streets, and they are constantly therefore at risk of being injured in traffic accidents, or they might be attacked by other animals. They also end up eating from the overflowing rubbish bins. And this can easily lead to a formation of like a plastic-based foreign body in their intestines, and then this will cause colic, as Dr. Dinesh was already explaining. And now in this unorganized sector, these horses don't often have, there's often no veterinary care easily available because general practice veterinarians don't necessarily have a lot of experience and knowledge about horses, because the veterinary curricula does not really cover much about horses. The organized sector horses generally belong to people who will have the connections and empowerment, and the horses have the value that it makes worth calling in like actual horse specialists. And so those horses generally have better veterinary care available, but the unorganized sector horses don't have that. And here, just a couple of pictures, common scenarios as roaming horses are found on the streets eating garbage. And what can then happen is that this garbage gets stuck in the intestines, and this often leads to fatal colic. So I have listed here some of the key skills for horse caretakers that are not veterinarians, which I assume in the audience there are many who are not veterinarians. So if you are dealing with horses, these are the sort of key skills. Now, Dr. Dinesh already went through the natural behavior and environment to some extent, so I won't get into that. It is important to understand about safe handling, including also transporting horses. Then the sort of general daily care, grooming, picking up hooves, cleaning hooves. You need to understand about feeding, as well as then hoof trimming and farriery work. In these images, here I show this one injured horse on the roadside, which I'm there rescuing. This was a free-roaming horse. It does not have any halter, and I wasn't having a halter with me as I went to see this horse. So what I have done here is just a piece of rope that was in my car, and I've made that into an emergency halter. And there's another picture here also showing how it can look like. So this is one good skill to have for any, whether veterinarian or non-veterinary. But if you are to deal with horses, you would need to know how you could just, out of a regular rope, create a system to restrain the horse and also walk it the way to, to a transport or to a safer place, for treatment. Also here, this image is just to emphasize the original natural environment of horses and the behavior and the fact that they are prey animals. But since Dr. Dinesh covered that, I won't go much into that now. The pictures I have included here are just some of those must-haves. So anybody, whether this is in a hobby farm or shelter or a more organized stable, you do need to have these items. So a hoof pick, a head collar halter, a lead rope, and then the last picture is a nose twitch, and there is a couple of other images showing how to use that. So this is a restraining method for short term if you're doing a procedure or giving say an IV injection to a horse, which is a little difficult to handle. By kind of twitching their nose into this nose twitch, they tend to stand calm or calmer, and then that difficult IV injection can be given. So these are very useful tools to have at hand. It's really all about the gut, just like also Dr. Dinesh already mentioned. Here I have kind of given an example of a horse daily feed, how that could be. So generally, they need 2 to 3% of their body weight as food, which should be divided into roughage, that's hay, and then concentrate feed if they require more energy. If you make any changes in the horse's diet, it should be made very gradually because they are very sensitive to changes in their intestines, and then again, that can cause colic. So if you have a 500-kilo horse, which is a big horse, a lot of the working horses or the unorganized sector horses are actually smaller than this, and more around 200 to 300 kilos. But now I have just here the sort of a easy number example of a 500-kilo horse. So this size of a horse would need 10 to 15 kilos of food every day. And then, of course, there's a difference in depending on what kind of, is it in a very intensive work, or is it just sort of a maintenance, or is it probably maybe nursing, lactating, and pregnant. And so the food is made out of the roughage, that's the hay or the grazing that the animal has access to, and then concentrates. Now, the concentrates can be, depending what's available locally, oats, corn, bran, chenna, horse gram, or, commercial premix. And then horses are often, they also require salt and mineral mixtures to make the diet balance. So yeah, as a practical example, if you would give 10 kilo feed for a horse of 500 kilo, this could be 6 kilos of hay in a day and totally 4 kilos of concentrate. And this would be divided into 2 kilos morning and 2 kilos evening, for example. Or if you want to do 3 times a day, then this could be also divided into 3 meals. So it's just a good idea. It's a good thing to keep in mind how many kilos actually a horse requires food in a day. Couple of images of hoof structure, and I'll mention a little bit about the care. So again, cleaning hooves every day is very important. This is to check that there are no foreign bodies, stones, anything stuck inside. Also checking that the hoof is, the frog, all the structures are looking the way they should. And noting any abnormalities or any signs of infection in time is very important. And the hoof really is really crucial structure. There are a lot of, very essential anatomical, little details in it, and any injury into that area can really it can really destroy the horse in a sense that if they cannot have a function, if the hoof is gone, then the leg is gone, and then the horse is gone. Again, as we pick up the hooves, on a daily basis, and as we observe horses under our care or a patient that's presented, we would need to go through the hooves, also picking them up. And here you can see, a couple of problematic hooves. We have a very overgrown or badly grown frog. Frog is the sort of a triangular structure at the center. And in the first picture, that's infected, and there is overgrowth. This hoof hasn't been trimmed for a long, long time. So there's a lot of issues there. In the photo in the middle, the frog is kind of looking okay in terms of its shape. It does need a trim though. And the hoof is a bit small, so that's one issue in this case. And then the last photo shows hooves. It's a bit in the shade, but those hooves are way too long, so that also needs urgently trimming or farriery work to trim to shorten the toe, the front of the hoof. And again, the tools that are required for proper hoof care. Here I've got some pictures of some basic farriery tools, and then there is also our WVS, our farrier Sam, who is actually in these pictures. He's attending a farriery training in Rajasthan. So this is something very important for any, again, hobby farms or animal shelters. If you are attending to horse cases, to have one person trained in basic farriery skills, this is hoof trimming skills, is really, really important. And this place in it's in Rajasthan now. Now I cannot remember exactly the town there, but this is in Rajasthan, and it's called the Flying Anvil, and it's a farriery school set by a Swiss farrier, and they run these really, really professional farriery training programs. And I do highly recommend that. Our Sam was really impressed by, and we've been really impressed with all he's learned. Looking then into veterinary skills that I consider the basics in equine practice. This is just my own sort of differentiation into level 1 and level 2. It is not any kind of official, there's no official differentiation like that, but I think this makes sense. So if you are a vet who's working in a shelter where there could be some rescued horses, or then the minimal skills you would need to have for that is to how to do a clinical examination on a horse, how to give IV, IM, and oral medication, how to do a standing sedation, how to do teeth rasping, how to do stomach tubing. And then you would need to do rectal examination in cases of colic to assess the situation of the intestines. And you would need to understand the principles of wound management, dressings, and bandaging. So this is like for a vet working in a shelter, even though the shelter would mostly be catering for cattle and small animals. But if there is a chance that there will be horses, then this is really what I think would be sort of minimal skills. As a level 2, I consider then skills that a vet who is working in general practice, so not only in a shelter, but in a general practice, attending to also horse cases, attending to horses that are with their owners, kept for some purpose, and not only, shelter animals. These vets should definitely be able to also do a rectal examination for reproduction examination, so assessing ovaries and pregnancies, general IV anesthesia on the field, castration and gelding, and then other surgical procedures as well. They would also need to be able to do some basic lameness examination. Hold on one second, my phone. No, now it silenced itself. Here's an image. Again, Dr. Dinesh already mentioned this, the importance of the teeth rasping and the way the horse's teeth grow. They grow in length, and they also grow these kind of spikes and sharp points. And if these sharp points become too long, then the grinding movement of the upper and the lower teeth cannot happen. And then the grinding movement is really important for the horse to be able to chew and eventually utilize the roughage, the hay that they eat. So they have to be able to chew it so that it can be swallowed. And so if these sharp enamel points are too long, then it kind of blocks the grinding movement. So tooth rasping is a regular routine part of a horse care, and this should this should take place at least twice a year, probably more frequently if there are specific problems, but as a routine, twice a year. And yeah, so here just in this picture, you will see that to do this teeth rasping, the horse is usually, I mean, it should be sedated. It's a standing sedation. And then you need to have a mouth gag that opens the horse's mouth in a way that you are able to put the tooth rasp in. Moving then into this wound management, which is really, really important topic in horse care. The first principle is really to do no harm. A lot of chemicals that are marketed for wound management or wound care, sprays, ointments, a lot of them actually are not good. They may do more harm than good. So just always be very careful in what you apply on a wound. Badly attended wound or neglected wound can cause Proudflass, and that can lead to chronic non-healing wounds. And if we have also, then of course, depending on the anatomic locations, if the wound includes the joint, and if there is an connection into the joint, then this can also further cause chronic lameness. Chronic lameness then means that the horse is not able to use that leg properly. And then again, that might mean that the horse is no longer useful for the purpose that the owner is having it. So these are very important and serious matters. Wound healing can be divided or is divided into 3 stages. We're talking about inflammation, proliferation, and remodeling. And it's important to understand these stages because the way we manage or the kind of dressings we do or whether we use antibiotics or not and all that depends on the stage of the wound healing. So the bandage is never for the purpose of keeping the wound out of sight. There are different types of dressing materials and different types of dressing concepts, and what you use depends on at what stage of wound healing we are. Generally, the layers of a bandage is first we have a primary layer. This is the layer that comes in contact with the injury. And this can be adherent, meaning it will stick to the tissue, or it can be non-adherent, meaning it does not stick to the tissue. After that comes the secondary layer. This is can be as simple as just roll cotton. So this layer provides padding and support. Baby nappies can also be used at this point. And then the third layer is to confirm and fix the bandage in place. And for this, we use like a regular gauze roll bandage, maybe a vet wrap, which is something that adheres to itself, or you might use a masking tape, especially in cases of hoof bandages, for hoof abscesses. I've just given some pictures here. As a primary layer, so we can have just a regular sterile gauze pad, or we can have honey gauze dressing. Honey gauze dressing would be an example of a non-adherent dressing, so it does not stick to the tissue, whereas just a gauze pad would stick and would be therefore adherent dressing. As a secondary layer, either just roll cotton or these kind of soft pan, cast padding type of supportive layer, or the baby nappy, as I mentioned. And then as a third layer, we can have these, vet wrap or masking tape, for example. Wound lavage is a really important part of wound management. So this means we are flushing. We are flushing away visible dirt, visible contamination, and also potentially, like a bacterial contamination. What we apply, what we put into the wound, there's one golden rule, which is really important. And this is that to a fresh wound, you should not apply anything that you could not apply under your own eyelid. And this is a way, if you keep that rule in mind, it saves you a lot of badly managed wound, disasters. So if anybody is selling or advertising a wound treatment product of any kind, you ask that person, can you apply this under your own eye? If you can't, because it's irritating, then you cannot apply it to a fresh wound, because indeed it will be there irritating as well. So tap water is a great thing to just for initial lavaging, flushing away the initial contamination. You can use it just through a garden hose pipe with a moderate pressure for about 10 minutes. You can then move on to use a disinfectant lavage as an optional. You can use povidone iodine or chlorhexidine as the base, but you have to really remember here that they have to be correctly diluted. So if you use these disinfectants as too strong solution, they will be more harmful than doing good. You know, they will be too harmful. That means they are destroying the healthy tissue and they are therefore delaying the wound healing. So I've got these images here instead of, giving any sort of difficult calculations of how we do the correct dilution. If you use povidone iodine, the correct dilution looks like weak black tea. And if you use chlorhexidine, the correct dilution looks like iced tea. And this is they shouldn't be stronger than this. For maggots, manual removal is the first thing to go for. After that, you can apply injectable ivermectin topically. Remember, ivermectin is never given as an injection to horses, as in like a subcut injection in a sense of as a dewormer. We use oral ivermectin as a dewormer for horses, but we can use injectable ivermectin topically, like 0.5 or 1 ml into a place where we are seeing or suspecting maggots. And then we go for, the support and protecting the wound with appropriate dressings. I will show what is a tie-over dressing, which is a really important skill to have or concept to have in horse bandaging. Pain relief and rest is, of course, important. So common drugs for pain relief would be flunixin, meloxicam, or firocoxib. And then depending on the severity, we are talking about stable rest or paddock rest or just less work. Antibiotics would also go, again, very important to have the correct dosing. And then tetanus vaccine would be the thing to do if not given within the last 6 months. And then obviously daily assessment and evaluation of the treatment plan. So here I have a case example. This is a very recent one. This came to us exactly a week ago. So this horse or this pony stallion was hit by a vehicle in Coimbatore, and the people there reached out to WS India for help. And so we sent our ambulance vehicle there, and it was transported to our shelter for inpatient care. But in these pictures, you see the wounds as they initially were. Now, moving forward, well, here we have first couple of pictures of just the initial transport, loading as well as unloading. And in this picture, then in the at the bottom in the middle, you see how the wound is looking kind of the day after. And you can see that there's sort of a flap of a skin that's going to go to necrosis if you leave it like that. And there's hair. Hair will always maintain dirt, and it means that the wound is more difficult to keep clean. And therefore, the number one important thing in wound management, which any non-veterinarian can do as well, is to shave the hair off. And here we've got Sam, the same Sam who was there doing the Farriery training. So he's here now shaving the hair off. So for shaving, again, things that you have to have, either you have a clipper, like a battery or chargeable kind of clipper, as in the picture here, or just a manual blade and a shaver concept. But, shaving the hair is absolutely the number one thing to do in wound management. When I saw this horse then the day after, I did surgical debridement with standing sedation and local anesthesia. So I cut off that flap of skin and all the sort of part that I could see that will be going into necrosis and will be unviable. And then we applied wet to dry dressing with a tie over bandage. So this is the one that I want to show here, and everybody kind of see this. So when we have a injury in a location where we cannot do round and round bandaging. So in horses, if the wound is in their legs, you can obviously wrap the bandage round and round the leg, but often the wounds are in other parts of the body. And so the question is, how do we apply a bandage here? So we do it by fixing these, they're called stay suture loops. So around the injury, I have made suture loops, and then as I apply the dressing in place, the primary layer, the secondary layer, and the third layer, I then fix it in place. In this case, I used IV line that I put crisscross, through those suture loops, and it kind of packs and helps to keep the dressing material in place. And then we change this daily. We do daily lavage. Change the bandage, and this horse was on IV penicillin twice a day for 4 days. After 1 week, so these are the pictures from yesterday, we can now see that there is healthy granulation tissue forming. We don't need any antibiotics anymore. We also don't need wet to dry dressing anymore. So we can either go for moist, non-adherent dressing like honey or silver sulfur dressing, or we can leave it also without dressing, but just maintain the daily lavage and checking on it. And at this point, we also then could remove the suture, stay suture loops if we are not having a dressing there anymore. So the few things that the last thing I wanted to, or almost the last thing I wanted to cover here is just my recommendation for basic medicine stock for horses in a shelter. So what I think any shelter that has horses should have, or any vet who attends basic horse cases should have these, so we should have the option for a standing sedation as well as for general anesthesia, which is then the diazepam ketamine. We need them for that. For the general anesthesia, also lignocaine is very important, and you would also need to have some euthanasia drugs. Antibiotics, again, less is more, keep it simple. I don't really see much need for have anything else than penicillin, sulfa-TMB, and gentamicin in stock. These are really, 90% of time you deal with these drugs. If you someday need something else, then go and buy that separately. But this is really most of the cases where antibiotics are needed can be dealt with these. For pain relief, flunixin is really good because it's an IV option. And as a oral drugs to sort of continue if you need, for example, in lameness cases, if you need to give for a longer time, then meloxicam and firacoxib are good options. You need oral dewormers, and then tetanus vaccine, IV fluids, and then, of course, the IV catheters and the giving sets. Liquid paraffin, very important for colic cases. You need a stomach tube as well to give that. So that's like an essential piece of equipment if you deal with horse cases. Some wound dressing ointments like honey, silver sulfur, or hydrogel, those that are safe, good, effective. And then you need, aseptic preparation materials like chlorhexidine scrub and surgical spirit. So if you have this, you are quite well set for most of the cases that you would be attending to. And then there is always this really difficult question of what to do with abandoned horses. Can they be rescued somewhere? We often get these questions. The truth is that most horses that roam on the streets, they're not abandoned. They do have owners. The owners just don't have stables or grazing lands to keep them. So it doesn't mean that you can take it away anywhere just because it's on the road. It belongs to somebody. And sadly, it's often only the most serious cases, fractures, paralysis, orphan cases that may not then be claimed by anyone. And these, of course, are then the ones where, all these cases here are presenting situations where we ended up with euthanasia because there was really no hope and prognosis for these cases. But sadly, new horses will quickly replace these. So overall, we would need to be looking for more sustainable solutions, Anyway, that's all what I had, little fast, but hopefully this was useful. And if anybody has any questions, I'll be happy to take them. Thank you.
Thank you very much, Ilona. Wonderful. Harshita has a question. What's the antidote for ivermectin, if at all administered, given?
Oh, you mean if it's given subcut? Antidote for ivermectin.
Yes, Harshita, if you'd like to ask the question again.
So
Hello.
basically, yeah.
Yes, in case of ivermectin poisoning, what's the antidote and how can we administer that?
I don't think there is a specific antidote, it's a symptomatic treatment if the horse would get some symptoms, but just generally do not use ivermectin as injectable for horses. It doesn't necessarily create a problem, but it's not recommended. So for deworming, so when we are talking about killing worms inside the intestines, you use oral ivermectin. And the only time you would use an injectable ivermectin is applying directly on the maggots. There was a question on hoof abscess. So hoof abscess is basically any sharp object that has penetrated the hoof from below. And the first sign of that is the horse is suddenly non-weight bearingly lame. So it's really not able to put weight on that leg, and it happens quite suddenly. So those are indications of a hoof abscess. The treatment is a hoof knife. There was I had a picture of a hoof knife among the Farriery equipment. With the hoof knife, you would need to open up that, from the bottom. So you basically look for a little black spot. You will identify where that sharp object has gone in and taken in bacteria. Then you use a hoof knife to open up the abscess so that there is ventral drainage. And then you apply a specific kind of hoof bandage, and then of course pain relief for several days and flushing and things like that. Hoof abscess cases do not require antibiotics generally, because the infection is very much localized inside that abscess, and once you open it up, it all kind of comes out. So that's that. There was hopefully that answers that question.
What drug is best for anesthesia?
So horse anesthesia is basically on the field. You would do xylazine and butorphanol for your standing sedation, and then you can do surgical procedures in standing sedation if you also combine with local block, like with lignocaine. However, a lot of procedures are then easier to do. Well, depends on the procedure, but if you want to go for general anesthesia, I basically do all the castrations under general anesthesia. Some vets do them in standing, but I do them under general anesthesia. So that means that after the standing sedation, I induce them with diazepam and ketamine, and with that they go down, and then I maintain that anesthesia with ketamine, diazepam, xylazine combo. As a bolus every sort of 10, 15 minutes, depending now what I'm doing and how long procedure that is. There's a question on euthanasia, basically sodium pentothal. So general anesthesia, inducing general anesthesia first, like I said, you do standing sedation first, then you induce general anesthesia, so the horse goes down. And you induce anesthesia as if you would be doing a surgical procedure. And when the horse is under general anesthesia, you then heavily overdose with sodium pentothal.
Also, one more, Ilona. Darshan had a question. They often rescue horses abandoned from the riding business on the beach. Yeah. Is there any particular farrier certificate which they can check with these owners who do such business?
Farrier business?
Yeah.
I'm not fully understanding.
Is that what it is, Darshan?
So people who, if somebody goes for Farriery, that Farriery training, for example, surely they get some certificate out of it. But I didn't understand actually the connection now to the abandonment of the horses. If you can just
Yeah.
ask the question again. Yeah.
Yeah. Okay. So basically, there are two kind of horses that we get. One is
Yeah.
that they are just standing on the roadsides and just acting like they are removing the plates from the hoof and they are selling it, and
Right.
they are just doing it over and over again
Yeah.
to put up a show.
Yeah.
And we wanted to add that part for the complaint that we do. So do is any official certificate for this work or the specific, because
Right.
I'm sure a specialist is needed to do that. So just wanted to, is there any
Right.
certificate or
Okay.
something?
Right. Right. I understand now what you're asking. So basically, what you're talking about is the concept of selling horseshoes to people who believe that a horseshoe brings luck.
Yeah.
So this is a concept that is not actually related to farriery work specifically at all. It is just a concept of it's a business, which is of course misuse and abuse of the horses, because you are not supposed to be shoeing them so many times a day. You are supposed to shoe them sort of every 6 to 8 weeks. And so when they do this, for the sake of selling the shoes, that's just simply a business for that. And so they hammer an old shoe, and then the client comes and they pull it out and they sell it as if this was a shoe on this horse for a long time. And then they hammer another shoe, and after 5 minutes, another person comes, and then they pull it out and again they sell it. So that's just the weird business. It's not really about farriery work at all. And obviously those people would not be trimming and filing the shoe and keeping it in shape, because they're just hammering and removing the shoes. So farriery field is though there are farriery training programs, like I mentioned, the one in Rajasthan. However, a lot of farriers are also, they learn along with somebody else, so there is no like official, there's no authorization and official certificate that all farriers would have, because many just learn it at the job, or they learn it from some senior, or they, like through apprenticeship. So it is not, you cannot say that a person, just because somebody does not have a farriery certificate, that he is not good or should not be doing it. So that you can't say. But you, of course, have to see that somebody who is shoeing a horse several times a day is not doing a farriery work, because farriery work involves shaping the shoe, shaping the hoof, looking at that balance and seeing, and then fitting the shoe according to that. And then that's it. That's done for the next, 8 weeks, and then only it will be redone. So that's a very different concept. So I think you would, you could be, I mean, I used to have, we had in our shelters actually 2 horses that were originally rescued from that type of shoeing business. And my understanding was that somebody simply video recorded that for a day, just to, and then made a police complaint. And it wasn't about lack of farriery certificate. It was just that this was this was a business, and not to, it wasn't what the horses were needing.
I just
Thank
wanted
you.
to add Darshan's point. This is the myth of selling horseshoe for luck, and it is very serious issue, because of continuous frequent nailing, frequent shoeing leads to foot abscess, cracks in the hooves, and the horse may lost their hooves and life. So only the behavior change and maybe the local reinforcement is required in this case. And as Ilona mentioned, there is one Farriery school. It is in Dunlod, Rajasthan.
Yes.
Yeah, who runs the Bernard, who runs
Bernard,
this.
yeah. Yes.
Yeah. So that is, I mean, apprenticeship. If you want, you can send your staff or acquire this skill.
Thank you, Dr. Dinesh. A question for both of you. How can we improve and spread awareness about equine welfare? What would you say are your most important inputs for this?
Well, I think there are like maybe in yeah, like in different levels, like of course general public to simply understand more about horses and the requirements and horse care. Then the other thing is, of course, or maybe in 3 levels. So, general public and what they might need to do, what tourists might need to understand before they go for tourist rides in places where the horses, for example, are not well kept. So that's like that kind of awareness, which could be in terms of, I don't know, signboards at tourist riding spots or just sort of general riding in different medias. Other thing is then horse caretakers, again, in this unorganized sector, whether they are tourist riding guys, whether they're working horse owners, or whether they are people in the shelters who might have a good heart and an idea that they want to help. But again, if they don't have much of horse specific knowledge, then that may not always go well. And sometimes, that can be an issue as well. And then, of course, the veterinary skills development, to again enforce and encourage vets to learn, to be able to handle basic cases, so that again things wouldn't get too bad. Those would be my ways to look into it. Anything, Dr. Dinesh?
Yeah, I agree with you. Yeah, awareness and education is very, very important, particularly when these animals are being used in the hill areas. The tourist needs to be educated, not to ride, not to ride a long distances or continuous work. So education and awareness is very important to improve the equine welfare in the country. Yeah.
And then another thing is that we often sort of point fingers to horses that are roaming on the roads, as if to say that, oh, see, this horse is not in a stable, therefore it's not looked after well and it's suffering. So that's kind of a default way of seeing it. But at the same time, like there was a comment I just saw from somebody that in the organized sector, sports, in racing, and in the other equestrian sports, the most expensive and well-fed and so in a way cared for horses often suffer from lack of access to grazing and paddock time, and lack of access to be with other horses, having like actual touch and smell contact with another horse. And as Dr. Dinesh said before, horses are herd animals. So it is an important part of their welfare to be able to be out, to be grazing, and to be able to touch and groom and be together with other horses. And so while we are easy to point out the welfare problems of these tourist riding horses or the working horses that are not living in stables, we sometimes fail to see that actually there are also those horses that are living in stables full-time or almost full-time, and they are suffering from other kind of issues, welfare issues. So it's not having the horse confined in a stable is not necessarily a guarantee that it's having good welfare.
Yeah, just I wanted to add one more thing, Ilona. In the equine welfare or horse welfare, mental health is very, very important.
Yes.
So unlike there are the 5 freedoms, very well, all of you.
Yeah.
So we have done this in our projects. So whenever there is, you might have heard about the cattle judging, the good animal, there is a competition to select good cattle or good cow or buffalo. So same way our team started, healthy or happy donkey competition. So what does mean happy? So there are some indicators which needs to be assessed. Earlier, what happened? They assessed only, like in case of cattle, how they assess? They assess on size of the udder or the production of the male. So these are the criteria for best cattle. So in the same way we did, happy donkey means we have to consider their behavior indicators, whether animal is happy or not. So the same happened in the race industry also. I have gone through one article. I mean, they have incorporated in the criteria, the horses in the riding industry, they should be happy. I mean, while the judging or the monitoring, so this happy means if the owner or any caretaker, if he or she is giving proper care, so definitely there will be no issues related to the animal's behavior. So this behavior is very, very important in animal welfare. Otherwise, what happened? We always talk about the good food, good shelter. These are the inputs. But at the end, animals should be happy.
Yeah.
So
Yeah.
this is very important. And in the welfare world, not only with the horses, but in other animals also, the main important which we miss, I mean, generally people miss, is animals should get opportunities. That point is, I mean, this is very important. If you are giving everything, but animal doesn't have any freedom to, do their naturalness. So this naturalness is very important. If horse or donkey wants to roll, because that is their naturalness, that is their natural behavior. If we restrict them, if suppose after the work, if donkey owners or horse owner not removing the saddle, how the animal will go and roll, how they express their natural behavior, they won't. So providing the opportunity, I mean, allow them to access the pasture, access the water, access the shade, express their, allow them to express their natural behavior. That is a vital part of any animal welfare. Yeah.
Thank
Yes.
you, doctor.
Yes, very true, very true.
A question from Nandini. Is there anything in particular that you have seen that works in a shelter in terms of stimulating a horse's mind and their social behavior?
Well, the first thing would be to have them with company. So the natural thing for the social stimulus requirement would be to have them with another horse, or with another animal, at least, like ideally with another horse, or horse, pony, and horse and donkey, so that they are together in a paddock where they can move freely and they can have contact freely with each other. And that would be one very important thing, that they are able to graze, and which is their natural behavior, and they're able to have company. There are then also, various sort of stimulus type of toys, of course, that can be used. And then the way we work with them, as in the way the humans handle them, they can be, even if a horse is not, if you have just one horse, for example, and if it's not, it doesn't mean that you have to ride it. Like, working doesn't mean necessarily that, but it could mean, providing some kind of, like from ground, going for a walk, taking the horse for a walk, just, being with it, grooming it, talking with it, talking to it, just, kind of teaching different things. You can teach a horse to, I don't know, go down or bow or kiss or things like that. So teaching them to lift up their legs, for voice cues. So those are some of the things that can be like stimulating their brain. But really the best thing is just simply to have another, not to have them alone. Make sure they have access to grazing or paddock time and with a friend.
And the last question, Ilona, Dr. Dinesh. What causes EIPH in horses? It would be great if you could give more info on that.
Well, this is exercise-induced pulmonary hemorrhage. If I understand, this is now what is being asked. So it's basically bleeding. I am not very familiar with this because it's more of something that may happen, as the name says, it's exercise-induced. So that's something that would be more common after, like, really intensive sports event, like a racing or a high-level jumping event. I don't deal much with horses in that level in this field, so I'm not that familiar with that. If Dr. Dinesh can put more light in it, but basically it is something that causes bleeding from the lungs, and that comes as a severe, can come out as a severe nosebleed. Anything you want to say?
No, I also, not have experience with the sports horses or
Yeah.
race horses. But it is a very serious issue in the race industry.
Yeah.
It's highly prevalent. Around 90% plus is the prevalence. And because of pressure, the capillary get damaged.
Yeah.
And yeah. So sorry, I don't have the
Yeah.
full knowledge about the.
Yeah. But it is basically a matter of, intensive sports like racing.
Yeah.
There was some question about the age for retiring. Well, that again really depends on what the horse is doing and how its health is otherwise. So, you can have a pleasure riding horse that's been ridden lightly, until they are, I don't know, maybe 25 if they're otherwise healthy. But often there are the limitations to use come along with the age, and this could be arthritis or loss of muscle mass or something, or lameness, arthritis causing lameness or something else causing lameness, or bad teeth that then end up the horse, to lose their body condition, and therefore then you're not able to use that horse anymore for the purpose. But then if those things are well taken care of, then there's no reason why the horse couldn't be used at the suitable way, that again, depending on their body condition and training. So I'm trying to say is that we can't just fix a specific number in years as when the horse has to retire, because it really depends on what it is doing, and then other health issues.
Thank you, Ilona, Dr. Dinesh. I think we shall end it here because we've just gone a little over time. So thank you, everyone, really, and hope this was insightful for all of you and took a lot of notes. We will be having more such sessions coming soon. So thank you, everyone. Have a good weekend. Thank you, Ilona. Thank you, Dr. Dinesh.
Thank you, of course. Thank you, everyone. Thank you, Ilona.
Yeah.
Bye-bye.